Our next guest understands how an injury to the body can have you sitting on the sidelines. He was a cheerleader in high school and college. Today, he's an orthopedic surgeon. Dr. Thomas Tanous Jr. stopped by to share how one of the most common surgical procedures just got even better. With Jiffy Knee, the process for a total knee replacement is done with less cutting, meaning people heal quicker and are back in the game of life, walking normally without pain. And that's something to cheer about. Dr. Tanous, you grew up in Cyprus, former high school and college cheerleader, which basically is an athlete. So I always ask doctors, because medicine is such a wide range of things you could go into, why they chose what they chose. You did it through experience of your own.
Yeah, I think from a young age I was interested in medicine. I had a brother who had asthma at a very young age, and so I was kind of drawn to it. As I got into cheerleading, I started to think maybe orthopedics made sense to me. And
you had a couple of injuries.
And some injuries that happened to me that kind of gave me more of a personal experience, and so that kind of drove my motivation.
Yeah.
And so basically went into college, med school, thinking that's what I was going to do. You would have thought I would have ended up as a sports medicine doctor, but during one of my rotations, which I tried to go on the sports rotation, but it was full, so I ended up on this joint replacement rotation, and I loved it. And it's great taking care of older folks and people that are really suffering, and you really can make a difference. And
the need, I mean, I think I read somewhere that when it comes to orthopedics, it's been an increase of 375% because our population has gotten older. Young people can deal with situations like this as well through injuries, but as we get older, we're basically outliving some of our joints, aren't we?
We are. And I think as people are more active into their later years, I mean, a lot of these old, weekend warrior injuries, they start to add up.
Yeah.
So we see a whole lot of folks who've got what I would say is kind of wear and tear old age arthritis. Unfortunately, I see a lot of folks in their 40s who had an ACL tear, they've had surgery on their knee or injuries, and they come looking for a knee replacement much younger than we would have expected 30 or 40 years ago.
Yeah, all right. When we say knee replacement, what is the standard knee replacement? What's the procedure?
That's a great question, because everybody asks that. So this is a model I brought in just to kind of give you an idea of what a knee replacement looks like. A lot of folks come in, they think we just cut the bone above their, at the bottom of their thigh and above their kneecap and take all that out. But really we're resurfacing it. And so it's really a resurfacing of the knee replacement. And so if you turn it to the side, I think you can see pretty well. There's this cap that goes on the end of the femur bone here, and then there's kind of a flat plate. And that flat plate supports the plastic here. And that plastic is kind of what becomes the new cartilage. You still have your own kneecap, but the undersurface of it gets resurfaced by applying a little plastic button that goes there. That allows it to then articulate with the knee replacement throughout the range of motion.
Okay, with that said, what went wrong in our knees that requires something like this?
So we all have this cushion on our knee. And that cushion over time, either from injury or just from old age, can start to wear down. And so that thickness starts to get thinner and thinner. And once it gets exposed bone, there are nerve vessels and nerves and vessels right underneath the skin, the cartilage, excuse me, and that area causes pain. And so once you start to get that bone on bone, you start to get more aching and discomfort. Sometimes the knee will swell. So if folks will come in, my knee swells after I do too much activity, or it gives out on me, feels like it's going to be out, and that could be there's flakes of cartilage rolling around in the knee that are getting stuck.
There are some intermediate things that people oftentimes do, like you get like it aches every now and then, or it takes me a couple of goes to get up off the sofa, but oftentimes it's just intermediate. The inevitable is going to happen.
Yeah, so we basically tell patients we're treating the symptoms. We don't really have a way to reverse the pathology or what causes arthritis. And that includes injections. So lots of folks come in and get occasional injection. That works well for them. Knee bracing can be helpful for certain activities that make it worse. There's special braces that orthopedic surgeons can request for you that are specific for your type of arthritis. And then physical therapy. So the muscles support your knee joint. And if you have pain, the muscles get weak. And it puts more kind of, as you would think, like reactive forces and makes the pain worse. So we can realign that by really strengthening certain muscle groups. Yeah,
just like anything, there's always advancements. There is an advancement in how to do a knee replacement. It's called Jiffy Knee. This has been a game changer among some of your patients who just say, wow, so you're seeing some really great results with this. Explain what Jiffy Knee is, how it's different from the standard knee replacement that we talked about.
Sure. On this model, again, I'll just kind of show you. So on a traditional knee replacement, you have to imagine there's muscles all around here. But typically what you're going to see is the surgeon's going to cut through the tendon and part of the muscle and then slide the knee out so that you're exposing the knee so you can do the surgery. And that essentially is creating an injury to the knee. You're basically cutting your
trauma to the body. Yeah.
Trauma to the body. And so that's been the way that knees have been done for a long time. There's now the ability now, by taking that incision and moving it just off to the side, is to start kind of where your quad muscle ends over here and move the entire muscle and the tendon without cutting it.
Ooh.
So as you can imagine, if you don't have to cut the muscle, the recovery is going to be quicker. When you go to bend your knee, so as you can imagine, when you're bending your knee during the rehab from a knee replacement, if you have a repair across here, you're stressing that repair the entire time. Your incision is across the front, so you're also stretching the skin. All of the things cause pain and discomfort. So by offloading that, by not cutting the muscle and putting the incision on the side of the knee, there's no pressure on the incision. The quad and the muscle there reacts right away. People are getting their motion much quicker, getting independent without having to use an assisted device like a walker or a cane.
Wow, you were skeptical at first.
Yeah.
But the results, the proof is there.
You know, I had patients who'd come in and ask about this thing, and I'm like, I didn't even know what it was. I'm like, it's just some kind of marketing thing. I don't really, a knee replacement's a knee replacement. There's really no way to make it better. But then finally, I had a few people that piqued my interest and talked to some other surgeons who are using this technique, and they all told me the same thing.
Yeah.
It's a game changer.
And what are your patients telling you?
That's what they're telling me. I mean, they're coming from all over the state. And they all say, including a lady I did not too long ago who had a traditional on one side. She was in the room, it's 2 weeks out. She was basically walking without the walker. I could tell she was just pushing it in front of her. And I'd just seen a patient who had come in for the same thing. And I was like, can you just come out here and just say hi to this guy and just tell him about your experience? So she's 2 weeks out from a knee replacement. And she's like, I'd do this again.
Yeah, and she had a knee to compare it to. Yeah. So she was perfect for that.
And she said, knee replacement patients, they don't say they'd rather do it again in 2 weeks normally.
And I want to touch on something else you said. They come from around the state. We take for granted that we have so many great doctors here who are specialists in this city, but there are many parts of the state, they don't have orthopedic surgeons, so that's why they're coming in from out of town. With that said, even though this is less trauma to the body, there are some things you'll still have to go through. Recovery is still required, and physical therapy is still important.
Yeah, it's still definitely important. I think the amount of time that you need to spend in the recovery period is much less. And the physical therapy typically is a lot less because you're not having to retrain this muscle. It comes back much quicker. So that's my folks that I see are just super excited because 6 or 8 weeks later they're basically doing whatever they want.
So if you're having some of those knee issues that you talked about, the swelling, the knee giving out, it all starts with a consultation and we move forward from there. All right, thank you very much.
Thanks. Thank you.
I'm getting older, so I might come see you soon.
We'll keep a spot open for you.
Just tell me high heels have nothing to do with it.
It has nothing to do with it.
Okay, good. Jiffy Knee is the way to a faster recovery. To get you there quicker, visit jiffykneehouston.com. That's jiffykneehouston.com, or call this number on your screen, 281-955-7577, 281-955-7577 to book a consultation with Dr. Tanous today.